Hello and welcome to Here's to Your Health. I'm your host, Veggie Patty, and it is my pleasure to bring you the latest information on healthy living. Today we're on location in Rockwood with Dr. Christina Lucas. She is actually a member of the Henry Ford Wyandotte Health System, so welcome to the show, Dr. Lucas.
Thank you, Patty. It's a pleasure to be here.
I'm so happy that you decided to be with us today. Dr. Lucas is in family practice and also an osteopathic manipulative treatment is what you do. So we're going to talk about that a little later in the show, but you are a doctor of osteopathic medicine, a DO.
Correct.
And I know people hear the terms MD, DO, may not know the difference between them. So let's start off by telling the viewers, what is osteopathy?
Osteopathy is actually a Greek word. Osteo means bone. Pathos means disease. So osteopathy is the study of disease processes in the bone. And basically, the beginning of osteopathy was founded by A.T. Still, or Andrew Taylor Still. He is the founder of osteopathic medicine. And the way he started was he had chronic headaches. And what he would do is he would put his head back on a rope and let it hang. And he noticed that the compression from the rope made his headaches go away. So he realized from that point that there was an association between the bones and disease processes in our bodies. So he founded Kirksville Osteopathic Medical School in Kirksville, Missouri, and he developed a curriculum on teaching physicians that the body is a unit and that disease processes can come from various areas in the body. So he is the main founder of osteopathic medicine and the formulation of osteopathy.
Okay, great. Yeah. So can you explain, what is the difference between a DO and an MD? Because both of them are, both
Sure.
DOs and MDs are licensed to practice medicine.
Correct.
But what is the real difference as far as maybe the philosophy or the training behind it?
Both MDs and DOs have 4 years of rigorous medical school training, and they also have a minimum of 3 years of residency, which is after graduation from medical school. That's training where you're actually a licensed physician but working with patients and supervised by what are called attending physicians. So the training is the same. However, DOs on an average have an extra study in osteopathy, which is the manipulative portion of medicine. Most schools have at least a minimum set requirement of study of that is incorporated into the curriculum. And by doing so, we offer an additional benefit to our patients that we can use another modality of treatment to help treat acute and chronic pain and other disease processes.
Okay. So speaking of chronic pain and chronic conditions,
Sure.
Obviously we've seen those on the rise in recent years,
Yes.
and everybody has a chronic condition or autoimmune, it seems like, coming up.
Yes.
So how is the medicine that you practice, the osteopathic medicine, how is that able to help with the treatment processes for chronic conditions maybe a little bit differently than regular medicine would?
Great question, Patty. There are so many stressors that we are facing as human beings in this world right now. We have, everything at our beck and call. We have iPhones, iPads, and phones at our beck and call with texting and what have you. We have a lot of stressors in our lives, and those stressors do play a role on our bodies and takes our time, our emotions, and can really cause issue to our health. And we run at such a fast pace, not like we did 100 years ago where we didn't have cell phones and cars and things like that. Our bodies are just under an enormous amount of stress. And with those kinds of stressors, our body can't always handle it as well. Subsequently, all of these disease processes like lupus, fibromyalgia, chronic pain syndrome, sciatic nerve pain, piriformis syndrome, even just anxiety is so much higher and so much more prevalent in our patient load these days. Subsequently, we need to find other ways to treat it. The traditional allopathic or MD route tends to try to look at treating with medication and other behavioral modifications. Osteopaths, such as myself and other DOs, tend to try to look at other ways of treating those stressors to help eliminate those stressors from the body, looking into dietary changes, looking into manipulative treatment, acupuncture, acupressure, yoga, massage. There are so many other ways of treating and helping to eliminate the stressors that are plaguing so many people with chronic pain. As you know, pain is such a hard thing to diagnose and treat because pain for you may be different than pain for me or somebody else. That's one of the biggest challenges in medicine, Patty, is to determine what is pain and how do we find that pain and treat it. You can't see it. You know, you cut yourself, you can see, oh, you have a cut. I'm sure that hurts you. Whereas pain that's inside our bodies from oxidative stress, from lifestyles, from poor diet, from all of the things that are processed in our bodies, as you know, with processed foods and what have you, all of those can cause stressors in our body and we can't see it. Just people come in and say, I just don't feel right, or I just don't feel well. So osteopaths as a whole try to look at all of those things and try to put together a treatment plan that includes, sometimes medication is appropriate, but in addition there are other modalities such as manipulative therapy that can help work on what's going on in the inside and help the body to heal itself, which is one of the philosophies that Andrew Taylor Still developed, that the body is a unit and the body can heal itself.
Okay, great. So that was a really good explanation. I appreciate that.
Thank you. Sure.
So basically, for the viewers, the DOs take more of an integrative approach, more of a whole body approach, whereas MDs in allopathic medicine, usually it's you're looking at the symptoms and treating those symptoms.
Right.
And so sometimes, and it's not all doctors, because doctors have different trainings and everybody has different backgrounds.
Sure.
But the philosophy in general, more of the whole body approach is what a DO would take.
And it's our society too. I mean, there's a lot of change going on right now with healthcare and what have you, and it's the time factor too. A lot of osteopaths who do manipulative medicine are blessed to be able to have more time to spend with their patients. By doing the treatment, we're able to discuss issues, to say, what's going on in your health? What lately has been bringing on your anxiety or your pain? When was the last time you felt well? What was going on at that time in your life? So we're able to also use some psychology and psychiatry medicine as well to kind of get to the root of, to say, well, I've had a lot of stressors. I'm taking care of elderly parents. I've had a sibling who passed away. I've had job issues. All of those things create stress and help to cause stress and can bring about disease processes in the body. So as an osteopath, I really like to be able to spend the time with my patients while doing treatment and to really delve into the underlying cause, which is a really key thing with any disease process, is to find the underlying cause, because it helps everything fit together and understand why things are happening. And unfortunately, sometimes we don't know. We never get to that underlying cause. Some things you have to tell your patients, I just don't know. But at least there are options and things that patients can look into other than just traditional pills and what have you, that can possibly help them.
Great. So now we've been talking a little bit about the treatment, the osteopathic manipulative treatment, also known as OMT. So what exactly is it?
OMT, osteopathic manipulative treatment, or osteopathic manipulative medicine, OMT or OMM, is, again, a philosophy by Andrew Taylor Still that allows DOs to utilize our hands to see where in the body things are going on. Where is there tissue changes in the body? Where is there stiffness? Where is there pain? Where is there swelling? And we are taught through a rigorous 4 years of medical school on how to kind of see and feel where issues are that are going on. For example, you can have a patient that has gallbladder disease. And one thing that you can actually feel is oftentimes there's a tender point in the back that correlates with gallbladder disease. Again, similar to acupressure and acupuncture, we are taught that there are tender points and strain patterns that can be seen within the body, and that can help us to make a diagnosis and actually help confirm a diagnosis and also help us to know how to treat that patient.
So now, how is it different than chiropractic? Because it sounds like it's very similar to chiropractic.
It is. It is very similar to chiropractic. There are a lot of things that are very similar. The difference is in really the training. DOs have 4 years of medical school, where chiropractors, as a rule, usually have 2 to possibly 3, depending on their program. Chiropractors cannot prescribe medication or Schedule II medications, which are narcotics or other protected medications and things like that. Whereas DOs, like MDs, can prescribe. It's really kind of a hybrid, if you will, between chiropractic education and allopathic treatment. The difference as well, though, is in function. Andrew Taylor still emphasized structure and function. They're both integratively related, and they all balance and integrate with themselves. And again, you brought up integrative medicine as well. A lot of osteopaths practice integrative medicine and functional and holistic medicine because that is another way to help treat the body without following standard disease process, treat it with medication, which so many of us are used to with the allopathic philosophy. As a whole, though, osteopaths like to take from the best of everything. And chiropractors as a whole just do the manipulative treatment, and they can use different modalities as well. But again, osteopaths just have more training and a slightly different philosophy than chiropractors.
Okay,
So.
and we're going to do a demo
Yes.
shortly
Sure.
for an OMT to show people what it is and what it looks like.
Sure.
But can you tell us, first of all, tell the viewers, if somebody is looking for a new doctor, like let's say somebody has a chronic illness and has been around, has been to several different doctors, several different
Sure.
practitioners, and they just can't seem to find the right one that works, because you do have to find the one that
Yes, you do.
works with you.
It is the matching
Right.
process.
What do you recommend to people as far as looking for a new doctor? What should they be looking for? What types of
Sure.
questions should they ask?
Absolutely. I think it's important with your healthcare to shop around and to find someone you're comfortable with, someone who will truly listen to you, that will meet you halfway. Medicine is not a dictatorship. It is a democracy. It is two human beings interacting to say, here are the options, what do you want to do with it? I personally try to empower all my patients to say, here are your choices for things that I've found. What would you like to do? As a consumer, as we live in a consumer world, it's important to ask around. Ask your friends. As females too, when you go get your haircut, you ask around, who do you go to? And where do you go to get your car serviced? And who does your plumbing and things like that? Word of mouth is very credible. You can ask the insurance companies, you can look online, you can call around, but really the best way is to go and meet that doctor face to face and see how you're treated and make sure that there's a good fit. And get more information that way, because it's like dating. You may hit it off that first date, or you may not, and you may need to go back to see, was it just an off day or what have you, and see that there's an actual fit. Find someone who will listen. Find someone who will take the time and really empower you to make good health decisions. Find someone that you feel comfortable with and that you can be honest with. Honesty is so important. I tell all my patients, the more you tell me, the more I can try and help you. Because the more pieces of this puzzle I have, the better job that I can do to service you. Those would be my humble suggestions for finding a doctor that would fit you.
Great, thanks.
So,
And a lot of times, like what I tell people is a lot of times with the insurance, you only get
Sure.
one office visit,
That's,
so it's hard to do that. So I
sure.
tell people, it really starts with your staff. It starts with the front
Oh,
desk. So
absolutely.
I will interview. I will interview the front desk staff when I call
Yes.
on the phone. I explain what my personal philosophy of
Yes.
healthcare is and see if the doctor's is in alignment with mine. If it's not, I move on right away because there's no
Absolutely.
point in going
Wasting
beyond
time.
that.
Sure.
I explain for me, as most of the viewers know, I have certain medical conditions, so I explain what my conditions are and find out if the doctor is even familiar with those conditions, because I don't
Sure.
want to go to somebody who's never heard of one of the
Absolutely.
conditions that I have.
Absolutely, that's very, very important.
So I do start off by interviewing the front. Word of mouth, online, do some research, and then I just
Sure.
try to interview on the phone. I just call and have a short conversation, and go from there. And if it seems like a good fit, I'll make an appointment with the doctor, and I interview the doctor in the first
Absolutely.
session. I say,
Yes.
hey, this is me. This is all about me. Do you think that you
Yes.
can help me and be my doctor? And
Absolutely, and it's so important. Unfortunately, again, the climate of medicine that we're in right now, a lot of times medicine has become fast food. And I humbly like to share with my patients, we're more of a bistro. We like to plate down and sit down, and the chef comes out and sits with you. That's more of an intimate one-on-one and a personalized touch and approach. Whereas a lot of other places, we call it the door knock doctor syndrome. You just have your hand on the door and okay, we'll see you, bye. And people don't like that. Everyone wants to feel important. Everyone wears a sign that says, what's in it for me? Make me feel important. People want to be heard. It doesn't mean necessarily a cure. It means they want someone who's going to listen and empathize, to know that, you know what, this is hard for you. I can imagine how you feel. And know that someone's there in their corner to say, yeah, this is difficult, but we're going to try and get through it together. And it may not be easy, but at least you have someone who's supporting you and willing to work with you to get to an end.
And that's what you're truly looking for as a doctor, that you can have a partnership with to advocate for your own
Absolutely.
healthcare.
It's extremely important, especially again with the way things are going with medicine. You need someone who's going to work with you and do as much as they can to help you. But again, have a mutual respect for one another and a mutual relationship so that you can work together.
Great.
So.
All right, well, we are going to go ahead and do the demo of OMT so that you guys can see what that looks like. So we'll be right back with you in a moment. We are now in one of the treatment rooms, and we have one of Dr. Lucas's patients, Diane, who has graciously agreed to volunteer to show us a demonstration of OMT. So I'm going to let Dr. Lucas take it away and show you guys what this is all about.
Sure. Hi everyone. I just wanted to have an opportunity to share with you what an initial OMT appointment looks like. This is Diane, and Diane is coming in today with just some chronic myalgias and just some chronic ailments that she's had for a while. Diane, how are you feeling today?
Pretty good today.
Okay.
After my last treatment.
Certainly. Can you describe kind of what's out today? What's causing discomfort?
It's still this area.
The same shoulder and what have you. Okay. And how's the breathing?
It was good. It's starting to get a little bit heavier, but it might have to do with the weather.
Sure, sure. Again, so many things can affect patients. The environment, allergies, things like that. Those all play a role in stressors. So what I'm going to do first is I'm just going to check and see where I feel tissue texture changes and tension in Diane today. You feel a little higher on that left side today, Diane. Would you agree with that?
Yes.
And looking at her scapula, which is here on her back here, she's a little bit higher on that left side. So what I'm doing is I'm just looking for abnormalities or structural things that look like they're out, is kind of how I put it in layman's terms. We don't like to use big words here. We would like to make sure everyone understands what's going on. I'm going to have you bend forward at the waist for me, please. And my left hand is coming up here a little bit, so that means something's going on Diane's left side here that's not in alignment with where it needs to be. Go ahead and sit up again for me, please. And go ahead and lay on your back for me. So, can you share a little bit about your first experience with OMT, what your thoughts were?
I wasn't really sure exactly what it was, but after having the first treatment, it convinced me that it could help me with what was going on in my body.
Sure.
And it has helped.
Wonderful. Can you share a little bit about on how it's helped your functioning?
My range of motion with my left arm has increased tremendously, and it has loosened this area up on my left side. As you noticed, she had talked about my left side being out.
Yes. Yes, yes. Well, that's great. If you don't mind, I'm going to just share a little bit with everyone listening that Diana suffered just with chronic myalgias, and she has something what's called IT band syndrome, which is a band that runs from up here all the way down the leg. It's called the iliotibial band, and it's a very common area for there to be acute and chronic pain. And what I do is I just feel for little areas, like little pinballs underneath the skin, and there are little lumps and areas of tissue soreness and gathering, and I just kind of feel where she's stuck. And what I do is I apply pressure, and by applying that pressure, the heat and the force causes that tissue to loosen, just like you would if you were arm wrestling or thumb wrestling somebody. That's kind of how I like to describe it. Eventually somebody fatigues. It's the same thing here, that eventually those muscles are going to fatigue. So I'm applying pressure here and just waiting, and then eventually we just feel it loosen up. Up there it goes. You feel that a little bit kind of loosen up, and eventually that tissue gets nice and spongy and soft, and hopefully Diane feels some relief with that. I'll bring this out this way. I always tell patients, wear comfortable clothes for your OMT appointment, because I do put you through your paces. I do want to check your range of motion and also see where there's limitations. So that's why Diane is wearing yoga clothes today. That's what I tell a lot of my patients. Push up for me a minute. What we're doing right now is a treatment called muscle energy. And what I'm having Diane do is meet me by applying an equal force, just like you would arm wrestling, against my hands here. And relax. Push up again. And I have her do this in several rounds here until her muscles loosen up. This is a very common treatment with physical therapy. If any of you have had physical therapy, a lot of PTs like to use this. Push up again. And relax. Very good. Now we're even. What I'm checking for is symmetry. When we have symmetry in the body, it really helps to know that everything is back in alignment. You may hear that term quite often. So what I'm checking is to see that her pelvis is back in alignment, which it is. So that shows that everything at the pelvis and sacrum down this way are improving and back in gear. And now what I'm checking for is her breathing. Diane mentioned that she had some issues with some breathing. So what happens a lot of times is that restrictions can occur in the thoracic and lumbar spine, which is part of the back. And when there are tight restrictions and tension, it can cause shortness of breath, it can cause asthma issues, digestion issues. So what I like to do is apply a pressure and help release that tissue. It's called visceral release or myofascial release. And by doing so, I'm just using my fingers and pushing upward on her spine and into her rib cage, and just waiting for that tissue to relax. And when that tissue relaxes, patients often ask me, how do you know when the tissue's relaxed? How do you know we're done? I ask them if you ever held a bar of chocolate in your hand. Chocolate is kind of stiff in your hands, and eventually by applying heat and pressure, that chocolate starts to melt, and you can actually feel it melt and get soft. That's exactly what I'm feeling with Diane's tissue here. It starts to melt, usually after about 30 seconds to a minute, depending on how restricted the area is. And once that tissue melts, that area gets increased blood flow, it gets rid of toxins, and has better lymphatic drainage as well. There it goes. Do you feel that? See, now she could take a deeper breath in. It's a wonderful thing. And now I'm going to treat up here too, because the diaphragm often gets restricted. Many patients who suffer from shortness of breath or feel they've got a catch in the ribs, sometimes it's also called costochondritis when you get inflammation and you breathe and you can't take that deep breath in. A lot of times there's restriction in the rib cage and in the diaphragm. So I'm doing a technique here called diaphragm doming, where I'm actually trying to get that diaphragm to release and just applying a little bit of pressure here and get that fascia to unwind. And by doing this, it helps what's called normalization of the sympathetic fibers. And I don't want to use too big of terms here, but the sympathetic fibers are responsible for our fight or flight, or deer in headlights, if you've ever heard that expression. When there's tension and stress on your body from everyday life or from chronic disease, those fibers are often very, very tense. And by getting them to relax, it helps normalize function, movement, absorption, digestion, secretions, breathing, everything gets better. This is why patients with irritable bowel, fibromyalgia, asthma, chronic allergies, anxiety benefit tremendously, endometriosis, other gynecological issues. There's a myriad of things that osteopathy can help treat. How's that feel? You feeling better? She's getting in the zone here, so that's wonderful. We're going to move a little further up. Another modality of medicine that I am certified in is called craniosacral therapy. Craniosacral osteopathy is an additional certification, and it works wonderfully to help treat acute chronic migraines, sinuses, allergies. Allergy season is huge right now, so we're going to do some things. What I'm checking right now are Diane's ribs, and she's got a rib that's up on this left side, so we're going to try and get that rib treated there a little bit, okay? There we go. Feels a little bit, there we go, a little bit better. You're smiling. This is a good thing. So again, this is a cranial treatment. It works really, really well for headaches. A lot of times people get what are called occipital migraines, which is right in the back here. That can affect your vision and other things. This works wonderfully for that. So I'm just going to do a treatment. What I'm doing is I'm just putting my hands at the back of her head here, and I'm just feeling where there's stiffness and where she's stuck, if you will. Today it feels like your right side is really boggy. Do you feel that there? Mm-hmm. Yeah. What I want you to do is meet me back here and push the back of your head in. And relax. Do it again. There it goes. Relax. One more time. And relax. How's that feel?
Feels
a lot
really
looser.
Mm-hmm.
Great. So there you have a basic OMT treatment for a patient with chronic disease processes. I hope this is educational and helpful for you. If you have any further questions or want information, please contact Patty. She will have all the information for coming in for a treatment like this. And also check with your healthcare provider as well if you have any questions or concerns.
Great. Well, I want to thank Dr. Lucas and for Diane for being the guinea pig here. And again, we will have the information for Dr. Lucas, how to reach her at the end of our show. And you'll also be able to check my website. I have her information up on my website as well. So thank you so much.
Thank you.
This was good.
Thank you for joining us today and for watching Here's to Your Health. If you want additional healthy living tips and tricks, please visit my website at www.vegiepatty.com, and we'll have the information for Dr. Lucas at the end of the show if you would like to get in contact with her. Remember, no matter your current state of health or the cards that you were dealt, you have the power to take charge of your health. So never stop learning and never give up. The solution you seek may be just around the corner. I would like to ask Dr. Lucas and Diane if you would join me in a toast to the viewers.
Sure.
We wish you a wonderful today and an even better tomorrow. Here's to your health.
I would say this is good.
Thank you, ladies. It's delicious. Thank you.